Assalamu alaikum wa rahmatullahi wa barakatuh. Hello everybody. We are come back again today to discuss Chlamydia, Rickettsiae, Ehrlichia and Anaplasma. The objective of this lecture is to identify the most properties of these bacteria and to identify the most disease caused by it, and also to demonstrate the laboratory diagnosis of these bacteria. While the third point in this lecture, we are going to manage prevention, control, and recommendation treatment for the disease caused by these bacteria. Firstly, I'm going to talk about Chlamydia species. Chlamydia are obligate intracellular pathogens. The most important character in this species is lack peptidoglycan in their cell wall, and as we know, peptidoglycan found between the outer membrane and plasma membrane. So this bacteria lack to peptidoglycan. It is contain DNA and RNA in addition to ribosomes. The bacteria that causes chlamydial infection to human are divided into three species. Chlamydia trichomonas, Chlamydia pneumoniae, and Chlamydia bestacei. All these species exhibit similar morphological feature and share a common group antigen, and it multiply in the cytoplasm of their host cells by distinctive replicating cycle. In addition to that, chlamydia can be viewed as a gram-negative bacteria, but it is lack muramic acid. In addition to that, it is lack to mechanism for productions of metabolic energy, so it is cannot synthesize ATP, cannot synthesize adenosine triphosphate. For this reason, this bacteria obligate intracellular parasite. Chlamydia trichomonas, which is the most important human pathogen as a major cause of genital infection and conjunctivitis, and the chronic form of Chlamydia trichomonas, conjunctivitis called trachoma, which is one of the most worldwide disease through the world. Chlamydia pneumonia and Chlamydia bestacei causes respiratory tract infection. So the chlamydia obligate intracellular parasite and share a common group of antigen. Chlamydia species that causes a human disease is divided into three species: Chlamydia trichomonas, Chlamydia pneumonia, and Chlamydia bestacei, which causes basticosis. Chlamydia pneumonia, formerly called TO citrine. The name comes from two original isolate Taiwan TW 183, and acute respiratory isolate AR39. في الحقيقة في سنة 1965 كلاميديا نيمونيا عزلت من عين طفل Eye of Child مشارك في برنامج تراكوما فاكسين. عزلت من عين هذا الطفل مشارك في برنامج تراكوما فاكسين في تايوان. ثم في عام 1983 أول عزلة سميت بالريسبيراتوري ايزوليت AR39 عزلت من طالب في جامعة واشنطن، لهذا سميت هذه بالتي وار سترين. Clinical manifestations of 3 species belong genus Chlamydia. Chlamydia trachomatis, it is one of the most important causes of genital tract infections, or what is called non-gonococcal urethritis, and also causes conjunctivitis, which called trachoma, and the infections depend on serovar or immunotype of Chlamydia trachomatis, while Chlamydia bistaceae causes bisticosis, which is a type of pneumonia, while Chlamydia pneumonia causes upper and lower respiratory tract infections, especially bronchitis and pneumonia. Transmissions of Chlamydia infection to human depend on the genus of this bacteria. Chlamydia trachomatis, which causes genital tract infections in addition to conjunctivitis or eye infections, is transmitted in case of genital tract infections occur through sexual contact, while in case of conjunctivitis or eye infections, the infections is transmitted through finger to eye or from to eye contact, while Chlamydia pneumonia, which causes upper and lower respiratory tract, then transmissions by inhalations of air droplet infected with these bacteria, while Chlamydia bistaceae, which primarily infect birds such as parrots and pigeons, the human became infected by inhalations of bird or animal feces infected with Chlamydia bistaceae. As we know, pathogenesis of any bacteria involve several steps, starting with the adhesion of the pathogens to special cells found in the host, or what is called physical interactions between host and bacteria. After adhesions, the pathogens enter inside the cell by a process called internalizations, or what is called induced phagocytosis. Then, inside the cells, the pathogen can survive and released from the phagosomes to infect the other cells and then replicate inside the infected cells. And this replicate inside the infected cell lead to rupture of the cells and release of the pathogens from the infected cells, and this process sometimes lead to appearance of cytopathological effects. After that, or the last steps, is the immune response of the host cell to the infection. This is a process or occur in any bacterial pathogenesis. In case of chlamydial species, replicative cycles involve two forms, which is firstly small, hardly infectious form called elementary body, while the second form large, fragile, intracellular replicative form called reticulate body. The life cycle of chlamydia species involve, as we mentioned above, two forms, either elementary body and reticulate body. The life cycles began when the elementary body attached to plasma membrane of the target cells, then internalized into the cells by induced phagocytosis or by process of endocytosis. Inside the phagosome, the elementary body can utilizing store of ATP energy by translocated recruiting proteins, which induce actin cytoskeletal rearrangement in the target cells. Then the elementary body converted to the replicating form, which is reticulate body. So the elementary body converted to reticulate body inside the cells. This form growth and replicate inside the cells. After the reticulate body growth and increased in number, the process is reversed and the reticulate body reorganized and condensed to yield elementary body again, which then released by exocytosis or by extrusion of intact inclusion cells. The cell lysis and the site of replications appear as inclusion body, which can be stained and visualized macroscopically, visualized by microscopes. Clinical finding of Chlamydia trachomatis result from different serovar or immunotype of Chlamydia trachomatis. There are at least 19 immunotypes of these pathogens. These included A, B, BA, C2K, and L1, L3. Type A, B, and C causes trachoma, while D2K causes sexually transmitted disease. These infections of D2K or genital tract infection can be sometimes transmitted to the eye or sometimes to the respiratory tract. In men, D and K causes non-gonococcal urethritis, which characterized by urethral discharge, and sometimes this infection progresses to causes prostatitis and epididymitis in addition to bronchitis. While in women, the genital infections involve cervicitis, which can cause salpingitis, and PID, pelvic inflammatory disease, and sometimes lead to sterility and ectopic gestation. In addition to that, patients with genital tract infection caused by Chlamydia trichomonas may express extragenital tract manifestations, which included arthritis, infections. In chlamydial trichomonas infections, this extra genital tract infections called Rickettsiae syndrome, which characterized by urethritis, arthritis, and uveitis. This type of infections, Ritter syndrome, it is an autoimmune disease caused by antibody formed against Chlamydia trichomonas antigen. So it is cross-reacting infections occur between Chlamydia trichomonas antigen and urethra or joint. In addition to that, Chlamydia trichomonas L1, L3 immunotype can cause lymphogranuloma venereum, which is a sexually transmitted disease with lesion on genitalia and lymph nodes. This is a clinical syndrome caused by Chlamydia trichomonas in men, women, and infants. You can see the complications in men can involve Ritter syndrome and epididymitis, while in women, endometritis, salpingitis, and perihepatitis can also occur, while infant pneumonitis and chronic lung disease also can occur. Diagnosis of chlamydial infections either by direct or indirect method. Direct method including culture on special media, or indirect by using serological test or PCR technique. Treatment of chlamydial infection including as a drug of choice azithromycin, doxycycline, while alternative regimen including erythromycin, levofloxacin, and ofloxacin. In pregnant women, chlamydial infection treatment included regimen from erythromycin, amoxicillin, while the alternative regimen included erythromycin and azithromycin. There is no chlamydial vaccine today, so the best preventive measure depend on limited of transmission by either treatment of patients and by early diagnosis of infections. WHO recommended strategies called SAF program, which stand for surgery of trichosis, antibiotic, and facial cleaning, in addition to environment improvement. So the SAF program is a strategy to prevent infections with chlamydial trichomonas. This program including surgery to prevent blindness in patients who have trichosis or intraocular trichosis. It is a common eyelid problem in which eyelash grow inward toward the eye, while intraocular a medical condition in which the eyelid, mainly lower lid, fold inward, lead to continuously rub against the cornea, causing irritations. The second steps in SAF program is a demonstration of appropriate antibiotic, including tetracycline, azithromycin, or alternative regimen to combat active chlamydial infections. While the third point in this program including facial hygiene and environment change. Now I'm going to the second part of this lecture, and I'm going to talk about Rickettsiae, Ehrlichia, and Anaplasma. This group of bacteria shared common feature. All they grow only inside living host cells and can be transmitted by arthropod such as tick, lice, and flea. The disease caused by this group of bacteria characterized by generalized infection with rash. So this bacteria, intracellular parasite, transmitted by arthropod vectors such as lice, flea, and tick. The cells small, rod-shaped cocci and often biliomorphic microorganisms. The clinical finding of Anaplasma, mainly Anaplasma phagocytophilium, it is causes granulocytic anaplasmosis, while Ehrlichia causes monocytosis ehrlichiosis, which is resembling to Rocky Mounted spotted fever, but it is lack to typical rash, while the clinical finding of Rickettsiae it's contain or causes many groups of typhus fever. The first group, Rocky Mountain spotted fever, which characterized by acute onset of non-specific symptom. The typical rash appear after 2 to 6 days and began as a macular papular rash, then can be progressed to vertical rash. The rash firstly appear on the hand and feet and then move inward to the trunk. In addition to the rash, the patient can express headache and other central nerve system changes. The other disease caused by Rickettsiae called Q fever. The main organ in Q fever is lung. The disease began suddenly onset with fever, severe headache, cough, and other influenza-like symptoms. Q fever is only a rickettsial disease that cannot transmitted by a bite of arthropod, because the main reservoir for human infections are cattle, sheep, and goat, and the disease is transmitted to human by inhalation of infected material of these animals. The causative agent of Q fever is Coxella burnetii. Typhus is another disease caused by Rickettsiae. This disease found in several forms, namely louse-borne epidemic typhus caused by Rickettsiae Kawasaki, and flea-borne endemic typhus caused by Rickettsiae typhi. Typhus, as a general, began as a sudden onset of fever, chills, and headache and other flu-like symptoms. Ehrlichia disease or recruitment typhus. It is a dormant form or it is latent form of infection caused by rickettsial bacteria. This infections, it is latent infection of rickettsial disease when the rickettsial bacteria can dormant in reticuloendothelial system, and this bacteria can reactivate after 10 to 40 years after the primary infections. So in Ehrlichia disease, the reticuloendothelial system maintain the rickettsial bacteria, and then this bacteria reactivated. So this infection, it is a reactivated or latent infections of rickettsial disease. Laboratory diagnosis of all rickettsial infection depend on cell culture or embryonated egg and serological test, and the main serological test used for diagnosis of typhus or other rickettsial infection called Well-Flex test. This test based on cross-reaction of an antigen present in many Rickettsiae with the O antigen polysaccharide found in Proteus vulgaris OX19. The test measures the presence of rickettsial antibody in patients' serum by their ability to agglutinate Proteus bacteria.